Always remember, anything that you may see presented in any of the stories here is in no way meant to diagnose or treat a particular problem in your personal pet. Only your veterinarian can do that after examining your pet thoroughly. So if you do have any concerns about a health problem in your pet, you definitely want to make a call to your veterinarian today.
And visiting us today at Spay Neuter Save is a very handsome feline named Bighead. He had originally come to Spay Neuter Save through one of our off-site feral TNR clinics, and at that time had some basic dental work done there where a few really diseased teeth were pulled. He was brought back to us today because his caretaker noticed he still was having issues with his mouth, not eating or drinking really well, and, well, as you can see, was looking and feeling kinda blah. We had seen him in the office a few days earlier and got him started on some antibiotics and pain meds in preparation for today's dental procedure.
So in the case of Bighead, we were really dealing with a lot of the secondary issues that we see from cats that have really uncomfortable and painful mouths because of dental conditions. So he wasn't eating well, he was not drinking well, and we did kind of see him a couple of days earlier, maybe even a week earlier, where we did treat him with a little bit of pain medication and some anti-inflammatories, trying to prepare him for being a little bit stronger to undergo this dental procedure. And he actually did quite well on those pain meds, which did tell us that obviously a lot of the source of his problem was the pain in his mouth, and especially with the teeth that he was suffering from. So really the only way to go in and heal all of this up is to do a full dental procedure on him. So we did put him under an anesthetic. We did go ahead and look at all of the teeth there. A lot of teeth were broken, some were partially missing. There were some root segments that were still kind of left underneath the gum. There were some lesions that we call resorptive lesions, where the tooth starts to erode a little bit right at the gum line, and all of these things combined just lead to a lot of pain, a lot of discomfort in the mouth. And so, when cats really hurt that much, they are just not going to eat, they're not going to drink. And the only thing we can do is go in and remove all of the problem areas in the mouth, which is what we did with Bighead. And once a lot of those areas heal up, we obviously will be keeping him on some good pain meds. He should be pretty much good as new and putting some weight back on and getting back to his big burly self.
With his mouth finally cleaned up of all the teeth and tooth root segments that were causing him issues, Bighead got some extra support with a bolus of fluids under his skin and some longer-lasting pain medications. After that, it was back to his caretaker for some rest, recovery, and we are sure some yummy softer food as his gums started to heal. How has Bighead been doing since his dental work? Stay tuned for an update on him coming out shortly to see how much of a difference your generous donations have made in his life.